So today's video is going to be on the functional movement screen, or the FMS. So the FMS is common in sports science. It's a movement screen, it's an assessment tool, and it is a good assessment tool. However, I wanted to talk about what it's not. It's not a prediction of injury tool. It does not predict injury well. So you shouldn't be telling people that it predicts injury, because I wanted to talk about how that's actually not true. So the FMS, what is it? It's a mobility screen, it's a movement screen. It does not have power components or high level strength or hinge movements, which reduces its ability to tell us more specific sport movements. It's meant to be a general assessment tool. So the FMS is actually near and dear to my heart. We spent 8 semesters in grad school of physical therapy testing athletes, talking about it, learning about it, researching it. And we actually have our own research study. Our doctorate research project was on it. So we tested 30 athletes in baseball, Division I in junior college. We tested them preseason and then postseason. We had the athletic trainers track injuries, track what injuries were occurring. We had them track how many practices and games were missed in the athletes and tried to compare the data. So initially, in the research on the FMS, a score of less than 14 was shown to be correlated or related to increased injury rates. However, it's not been consistently reproduced since then. In fact, a recent research study specifically on softball players found a score of less than 14 was not correlated or predictive of increased injury risk over the course of the season. So in our own study, we found baseball players averaged about a 15.2. That was the whole division, or our whole study average. One thing we did find is pitchers were generally poor at squatting, and that makes sense if pitchers are generally taller baseball players, and you can expect what to see there. We found pitchers had generally lower scores than position players. And you can look at movement. You can find a lot about the functional movement screen, but it's not meant to predict injury risk. Now, if you wanted to save time on the FMS and you were looking for power tests, strength tests, things like that, and you wanted to incorporate those, you actually can use the squat to predict you can use the squat to predict overall composite FMS score. So the squat has been shown to be predictive of the total FMS score. And the squat is a great assessment tool. It's used in TPI screening, it's used in FMS screening, and it's a great assessment tool, but it is not a predictor of injury. The FMS does not show injury risk. One of the main reasons is because, is it strength or is it a mobility screen? It's mostly a mobility screen or body weight control screen. It does not test the higher levels of strength. And one of the things that's been shown in injuries is it's usually related to volume or weakness. So if you're weaker, you're more likely to be hurt, specifically eccentric strength or the lengthening. So you're more likely to be hurt if you're weaker, has been shown to occur more than being hurt because of poor mobility. And that's very published in the hamstring literature. Hamstring is one of the most commonly studied injuries and mechanism of injury because it's so common. And a lot of good research comes out of Europe and Asia on that. And what they found is poor strength in hamstrings is more likely to predict injury risk, and then treating it by these lengthening contractions and strengthening exercises like the Nordic hamstring exercise, you can significantly cut down on injury risk without even stretching. So that was a little bit of a rabbit hole, but very passionate about hamstrings as well. But the FMS, back to the FMS, it does not predict injury risk. And in fact, it's been shown if you were to flip a coin for every athlete to predict whether they were going to be hurt over the course of a season, the FMS is only slightly better than a coin flip. It's slightly better than the 50-50 chance of being injured. And that has been studied in the research. So the FMS is a great assessment tool to add and use with your athletes, but it should not be used as a standalone injury risk predictor. So we should not be telling someone that they scored poorly on the FMS that they're more likely to be hurt, because that simply has not been shown to be true, because there's a lot related to volume as well. So if you have a poor score on the FMS, but you don't do a lot of individual work on your own, you don't do a lot of extra swinging, you don't do a lot of pitching or throwing on your own, or you just aren't playing as much, that has a huge ability to affect whether you're going to get injured or not. So if you're throwing a lot of innings and you have this huge workload, you're more likely to be hurt than someone who's kind of just resting on the bench. And that is why the FMS should not be used alone as a standalone injury risk predictor. So if you want more information on the FMS, I can send you some research articles I'll post, or I've shown some of the stuff we found in our research, but it is not to be used as a standalone injury prediction tool. Just wanted to clarify that because I see that a lot.